afternoon and welcome to the Rotary Club of Tulsa, Club 2500, District 6110. This is the 5,282nd meeting of the Rotary Club of Tulsa. Jeff Rudd is sitting over there today. You've been to what, 5,000 of those meetings, Jeff? Holy cow. We're glad to have you here with us today. We're glad you came. You're going to be glad you came to be with us. It's a great time to be together as Rotarians, especially in this season of gratitude and thanks. We've got a great program for you today. We're going to start with the invocation and pledge led by past President Corey Nickerson, followed by guest and new member introductions from multiple Rotary Award winner, past President Chuck Wilson. Corey.
Will you bow with me? Lord, we thank you for this day. We come to you with hearts of gratitude. We come to you with hearts geared towards service. Of the many things that this club accomplishes, Lord, it wouldn't happen without people. We thank you that we can apply the hands and the feet to the needs of this world. Keep us ever mindful of those who are less fortunate and how we can help. Keep us mindful that help one-on-one sometimes is bigger than the massive amounts of help. Lord, we pray that you would guide, direct our thoughts during this season. We honor you, we glorify your name. We thank you for people where we can connect. And it's in your name we pray. Amen. Before we do the pledge, there's one job that's always thankless. It's the guy that does the background music in a room full of people who are chattering. John Hamill, thank you. Where'd he go? Would you join me in the pledge? I pledge allegiance to the flag of the United States of America and to the republic for which it stands, one nation under God, indivisible, with liberty and justice for all.
Double duty and double pleasure today. Welcome to everyone to the Rotary Club of Tulsa. I am going to introduce our guests and their host Rotarians. If you'll please stand when I introduce you. Remain standing until all have been introduced, and then we'll recognize everyone. Corey Suber is here with Heather Lehman. Shanna Vollmer has Rebecca Hubbard. Amy Freeberger is with Jeffrey Rudd. David Wagner has brought Brian Lee Wisenhunt. And Jerry Dillon has two guests, Nicholas Tapper and Chip Keating. Would you please welcome these guests? And now for our visiting Rotarians. We have Jeremy Nichols from Southside. Also, our Assistant Governor, Larry Boyer from Southside. And you'll be hearing more about this gentleman in a moment, but Jay Albright is here from the Stillwater Centennial Rotary. Jay Albright. All right, now, Michael, will you please join me, please? You and your mom. Come on. This is a special introduction, Mr. President. Michael Albright grew up in Stillwater to a very dedicated Rotary family. His parents are both past presidents of the Stillwater Centennial Rotary Club and host the club meetings in their barn. That's unique. Yeah, that's unique. His mother, Kathy, who is here with him, is currently an assistant district governor for Rotary District 5750. Michael grew up around Rotary exchange students, hosting 13 students from all over the world. While in high school, Michael went to RILA, the Rotary Youth Leadership Awards, and participated in District 5750's Wings of Rotary trip, where he stayed with Rotary host families for 2 weeks while traveling around District 2520 in the Tohoku region of northern Japan. Michael graduated from Oklahoma State University in 2022 and Notre Dame Law School this past May. He is a lawyer at Connor and Winters, where he has the pleasure of answering to none other than past President Daniel Gomez. Fun fact, while at OSU, Michael was Pistol Pete and still sometimes does appearances. As a matter of fact, when Pistol Pete visited this club in July, honoring Daniel's year of service as club president, it was Michael. So, here's something very special, and I'm going to ask his mother to come to the lectern now, as she has something she wants to present to her son.
Thank you so much. Well, as it was earlier mentioned, we've been in Rotary for a long time, since before Michael was born, actually, and it's always been a big part of our lives, service, and we tried to raise our boys with service in mind, and it was kind of like, not, do you want to join Rotary? It's, who can we get to introduce you to Rotary? So it was kind of a no-brainer for him to ask Daniel, and thank you, Daniel, for sponsoring Michael. But one of the big things for us is we believe in the Rotary Foundation, and in honor of you all asking Michael or accepting him for membership, we made him a Paul Harris Fellow. And so, Michael, Mom had it framed for his office, so we would like him to accept this, and Michael, you are officially a Paul Harris Fellow.
You know, Chuck, that may be my very most favorite new member introduction that I can remember, sir. You're well worthy of all those back-to-back awards you won that year. That's exactly right. I wanted to point out a couple things about a couple of our guests. Brian Lee, who's here with Dave Wagner, is going to be the director at Gilcrease Museum. Is that right, David? No. He is the director at Gilcrease Museum. Okay. And then, do you recognize, we were introduced to Chip Keating. Does anyone recognize that last name as maybe related to our Sergeant at Arms and a past governor of our state and a great banker in our community? And so we're real glad to have you here today, Chip. And of course, we're always glad to see you, Larry Boyer. When you show up at our meetings, you bring a ray of sunshine we don't otherwise find. I want to thank everybody who did Shop with a Cop and Salvation Army bell ringing last week. You helped make spirits bright this holiday season. Your gift of time and generosity means so much to those who benefit from your kindness. As St. Francis reminded us, for it is in giving that we receive. Thankful for your gift of time last week. You know, got a little Rotary DNA for you today. I was talking to my friend Bob Sade, old man time, about women's suffrage back in 1920 when the United States government passed the 19th Amendment to the Constitution, giving women the right to vote. Why would I bring that up other than the fact that Bob marched in a lot of those parades? Well, from 1905 to 1985, Rotary International, the charter, did not admit women to membership. Nonetheless, as is true in most of our lives, women played a very important role in the Rotary organization. Jerry Dillon's the smartest man in the crowd. He started clapping for that immediately. So there was an organization that was founded from 1905 to 1985, no women in Rotary. But here in Tulsa, a lady named Amber Lancaster, in 1922, Amber Lancaster, then the wife of President Ben Lancaster, formed a Rotary Ann's auxiliary organization. And they named themselves the Amber Rotary Anns. For many years, the Rotary Anns made a meaningful impact on our community through the association with Rotary. They mended and served holiday meals for residents of the Tulsa Boys Home that our club was instrumental in founding. They organized countless social events for Rotary events and their spouses. Their fundraising efforts supported, and these are interesting, the Community Fund, the Tulsa Babies Milk Fund, the Public School Shoe Fund, the Salvation Army, and the American Red Cross. They also provided nursing scholarships, a lot of nursing scholarships to local young ladies who wanted to attend nursing schools. The legacy of the Rotary Anns organization reflects the very heart of Rotary, service above self, and commitment to strengthening our community. The work of the Amber Rotary Anns not only supported those in need, but also helped build the spirit of compassion and connection that continues to guide our club today. We honor their contributions, and let us be reminded that every act of service, large or small, helps carry forward the ideals of Rotary. Now, in 1985, we got smart. Rotary International did change the rules and allowed women to join the club. The first woman member of the club was a lady named Gladys Harrington. And some of you, I think, here, Don Woolsey, did you know Gladys? Yeah. And Scott, you knew Gladys? Gladys was the retired owner of Harrington's men's store, which is down on, was it on 6th and between Boston and Maine, I think? In fact, I think you can still see the faded sign that was painted on the side of that building if you go by and look for it. Our second female member was none other than Paula Marshall Chapman, Alabama fame. One of the things you probably don't know about Gladys Harrington that I found quite remarkable, you know the Azalea Gardens at Woodward Park at 21st and Peoria? Gladys Harrington was behind that. She put that together, helped fund it, and as Tulsans, we still enjoy it today. We're grateful for those members, those early lady members that have made it possible for us to have so many great members today. Speaking of great female members, help me welcome our Sergeant at Arms, Shanna Vollmer. Shanna, just before you start, I want us all to think for a minute. Shanna worked really hard and had the opportunity to get with Pedro not so long before he passed, Pedro Figueroa. And we have memorialized his experience with Rotary through the video that she so painstakingly put together, and she's going to do that for some more members. We don't want anybody else to die after Shanna does a video of them. Don't do that, but she's going to do some more of that. And Shanna, I want you to know how much I appreciate the work that you put into that and how meaningful it is to have that record of one of our very most prolific Rotarians.
Thank you, Carl. Yeah, sad moment for all of us, and just glad I got that opportunity to spend so much time with Pedro, but hit the heart heavy. Good afternoon, my favorite Rotarians. I wanted to, it's December, I'll be back next week, so I've got a handful of celebrations, birthdays, anniversaries, among some other things today, but if you haven't sent me yours, please do, and I will share them next week. First, I want to kind of kick off with our Be Like Case campaign. My apologies for not having the full list of all the participants participants, but I see you. And I'm working with Tina and DJ to get that list. You guys are doing a great job. Shop with a Cop, the bell ringing, all the great speakers. Continue to share the work of Rotary. That's how we get out in the community to get more people like us in this room. So thank you for your efforts. Your name will be put into that drawing, so just keep it up. First up for a celebration, I believe, next slide is, yes, our President-elect Karen McConnell, $80 for her 8th year in Rotary, $20 for 20 years at TMG, Macintosh Group. So thank you, Karen. Let's give her a hand. Next up, we have happy birthday, Bill Rickert, $200, his birthday, December 8th, so just a couple days ago. So happy birthday, Bill. Let's give him a hand. Then, of course, our very own Scott Philstrip giving a large donation to the foundation, $7,367 for his 57th anniversary to his wife, Margie. I hope I said that right, Margie. It's going to go $2,455.66 equally to Camp Enterprise, Crescendo, and Songs by Heart. So thank you so much, Scott Philstrip. And speaking of Scott Philstrip, I had the honor to sit with him last week at Junior Achievement and really interview him, grill him, drill him on all the things, and I am so excited. So be here next week. I know we have a great program scheduled for the holiday. That's where I'm going to air his interview, so please be here. Really enjoy the time. Thank you, Scott, and looking forward to that. Now, here's my sad face, though. I don't have anybody else to interview, so I need you guys to sponsor a member. As you can see where Carl pointed out, these are important to capture the moments. From new members to some of you guys that have been here a really long time, I'm learning a lot. I've got the best job in the house because I'm learning so much on how Rotary has changed so many people's lives. So you guys know all of these people in the room, so please sponsor. We've heard some great people, Jerry Dillon, Linda Bradshaw, Pedro, Sheree. So let's put some more names on the board. I've got some more work to do, so please sponsor a member. Thank you.
Shannon, can I?
Yeah.
Can I sponsor Don Woolsey and Bob Sade? Bob, would you consent to be interviewed by Shanna with me editing the video? You're still alive. Don, would you let her interview you? Miss? Yes? Okay.
Oh, you're on the list.
There you go.
Yeah, Bob, I'm coming for you. And don't forget, Bob's he's hooked me up with all the technology and was really instrumental in the Pedro interview. So thank you again for letting me use your equipment in these interviews. Thanks, guys.
Thank you, Shanna. Scott, I'm always set back just a little bit by your generosity, sir. Thank you. Thank you so very much for your contributions to our club. It's very meaningful. Here I am introducing another really incredible Rotarian of the day. Tiffany Egdorf is the CEO of Connection Companies, where she specializes in consulting for nonprofits. She holds a Bachelor of, never heard this one before, she holds a Bachelor of Science in Dance Management. What does a dance manager do, Tiffany?
I could tell you all kinds of stories.
Okay. Bachelor of Science in Dance Management from Oklahoma City University, a Master of Arts in Ministry and Culture from Phillips Theological Seminary, a Master's in Healthcare Delivery Sciences from the University of Tulsa. Tiffany is also a graduate of Leadership Tulsa, the Rotary District Leadership Academy, and the Tulsa Police Academy. I dare say she may be one of the most educated, well-rounded individuals in the room. She currently serves as the District Governor nominee for Rotary District 6110. Please join me in welcoming past President Tiffany Egdorf.
Hello. It's so good to be back up here again. I miss seeing your faces from this angle. All right. I have a wonderful pleasure of introducing my friend Kate Neary, who serves as the CEO of Community Health Connection, a rapidly growing, federally qualified health center committed to providing high-quality, accessible health care to all Tulsans, regardless of their ability to pay. She previously served as the CEO for Tulsa Cares and as Director of Strategic Partnerships and Development for Planned Parenthood of the Heartland. A longtime healthcare advocate, Kate brings extensive professional and volunteer experience in HIV treatment and prevention, women's reproductive health, and LGBTQIA+ advocacy and support. I have known Kate for many years and have had the privilege of getting to know her on a personal level as well as a professional level. She is passionate about her work, her family, and her friends, and she is a lot of fun to hang out with. I can speak to that, and we mostly behaved. Kate, it is an honor to call you a friend. Please help me welcome Kate Neary.
Thank you for that sweet introduction. Hi, everyone. It really is a tremendous honor to be in front of you today, and I really, really appreciate the opportunity to speak before you. Thank you, Chaz, for inviting me, and thank you to the Rotary Club for having me today. I'm going to be talking a little bit about Community Health Connection, my organization that I'm representing today, and then the broader impact of community health centers here locally and around the country. I love this quote, and we use this a lot in the Community Health Center family. This is from Dr. Geiger. He is an American physician and human rights activist, and he really was kind of the founder of the philosophy of what we talk about today as social determinants of health, social drivers of health. The poor are likelier to be sick, the sick are likelier to be poor. Without interventions, the poor will grow sicker, and the sick will grow poorer, and that has troubling consequences for all of us. So just quickly, my background, here 30 years in Oklahoma, didn't think I would stay here. I'm a West Texas transplant, but University of Tulsa and related experiences changed my life, and I just fallen in love with the community. I have went to TU, University of Oklahoma, has a certificate in healthcare executive program at UCLA. I am a National AIDS Fund AmeriCorps alumni, huge proponent of national service. That also really did change my life. I wish that was an experience that all of our young people took part in. Tulsa nonprofit healthcare work, about 25 years here in Tulsa, and like Tiffany said, it's been really centered around community health, reproductive health. I've worked with incarcerated populations, those living with chronic health conditions, and other life experiences, and I started as the CEO of Community Health Connection last March in '24. So a brief introduction to Community Health Connection, and then I'm going to talk broadly about the Community Health Center model, and then back to Community Health Connection. Our mission, very similar to other community health centers, is to provide quality and accessible health care across all life cycles, regardless of a patient's ability to pay. We were incorporated as a nonprofit in 2003 and became a federally qualified health center, or more commonly known as a community health center, in 2006. We focused on the medically underserved areas and population. We began serving about 2,000 people in East Tulsa, and the population and geographic footprint has grown significantly. Currently, our budget is about $19 million, and we're projecting to serve more than 20,000 patients by the end of this year. We have 4 locations, and 5th under construction that I'll touch on a little bit later. This is our largest center in East Tulsa. It's part of a community school partnership with Union Public Schools, our Ellen Ochoa campus. We also have another school-based partnership with Union Rosa Parks, and then our Kendall Whittier location at 3rd and Lewis. And we also have a downtown location that's part of a partnership with Youth Services of Tulsa on their campus. And that campus is really focused on anybody that needs the service that comes into contact with us, but really focused on Youth Services of Tulsa, patients and clients, and the homeless youth in that area. So I'll get back a little bit more specific about Community Health Connection, but what is a community health center? Some of you have probably, this is a very well-informed audience, I know, but just wanted to go into a little bit more detail about community health centers. FQHCs, like I said, more commonly known as CHCs, are funded under HRSA. They were first established in 1965 as part of President Johnson's War on Poverty. And due to population served, we qualify for an enhanced reimbursement rate for Medicaid and Medicare. And that is because we serve a large number of uninsured populations. And Community Health Connection specifically serves the largest number of uninsured patients within the Community Health Center family in Oklahoma. We must serve an underserved area and population, provide care regardless of a patient's ability to pay. We also must offer a sliding scale, so if a patient is not eligible for Medicare or Medicaid or private insurance, we have a sliding scale for them. And then we're required to provide comprehensive services, including but not limited to primary care, dental, behavioral health, and some other things that I'll touch on. So again, health centers are medical care homes. We really strive to provide as many services under one roof as we possibly can, and trying to eliminate as many barriers to care. 1 in 5 uninsured Americans, 1 in 3 living in poverty, 1 in 5 patients across the country live in rural areas of the state. I'm actually going to look over here a little bit. 1.3 million experiencing homelessness, 8.6 million children, 400,000 veterans, and 3.3 million elderly patients. And again, located in high areas of need, open to everyone, comprehensive services provided. And then another unique thing about us, we're independently governed as community health centers, so we each have our own CEO, own governing board, but 51% of our governing board has to be patients. So a big part of how we administer our services, decide our sliding scale, and all those other things, it is heavily reliant on feedback from the patients that we serve. And they need to be reflective of the community that we serve too. Community health centers have a really big impact on people living with chronic health conditions. And so this is just a slide representing primary health care and then community health centers. You can see there's a disproportionate impact of those living with hypertension, other chronic health conditions, diabetes. So we serve really the poorest of the poor and people that are needing a safety net healthcare provider. Community health centers also provide a really big value to the economy in general. We save 24% per Medicaid patient compared to other healthcare providers. And you can see as far as emergency room admissions, primary care, outpatient care, other care, we're providing those basic services that keep people from getting into the emergency room and needing other chronic health condition treatment. So Oklahoma Community Health Center value again. In 2023, we employed 6,108 individuals just in Oklahoma. We reduced healthcare costs, saving an average again of 24% per Medicaid patient, reducing hospital emergency room admissions, addressing societal change that affects such as diet, transportation, housing, et cetera. Again, I touched on, we try to provide as many services under one roof as we can. And we work alongside state and local governments and the entire healthcare system to address natural disasters, public health crisis. Community health centers was really some of the people on the front during the COVID crisis, for example, and then infant mortality care and more. So our footprint in Oklahoma, we have 22 community health centers in Oklahoma across 170 locations, and that encompasses mobile units and then satellite offices at community partner organizations. Again, we operate independently with board governance, and our trade organization is the Oklahoma Primary Care Association, and that organization provides technical support, data sharing, state and federal lobby support, and that board of directors is comprised of each CEO of the community health centers in the state. In 2024, community health centers provided more services to more than 345,000 patients. So a really broad scope of service that we provide in the state. And then nationally, in 2024, more than 32.5 million Americans access services through community health centers across 16,000 communities. So it really is a crucial safety net healthcare organization for our country. So in Tulsa, and back to Community Health Connection, 43% of our patients are uninsured, which again makes us a little bit unique compared to community health centers or the rest of them around the state. 85% identify as a racial ethnic minority, 68% are female. and almost all of our patients fall at or below 200% of FPL. So while we welcome any patient that may need the services that we provide, we really do cater to those who are most at need in our local community. About 32% of our patients are under the age of 18, about close to 40% are Medicaid, 2% Medicare, and we do serve about 17% of those of our patients who have private insurance. And this just shows you a little bit about our growth from 2020. We've experienced significant growth and then projected to experience our biggest growth this year by the end of 25, about a 17% growth. In 22, I wasn't there, but I have heard that we had several of our providers that were out on parental leave. At Community Health Connection, we seem to have a very fertile patient base or provider base, but we've experienced a real steady growth that we're really proud of. So our services, family medicine, the full scope of family medicine, reproductive health care, basic infertility services, contraception, family planning, STI, treatment and testing, prenatal postpartum care, the full scope of OBGYN care, including full gynecological services, tubal ligation, colposcopy, hysterectomy. We have a full pediatrics team, including immunizations and sports physicals. And then we're really proud of the fact that we invest a lot of time and personnel and chronic disease care management. It's an RN facilitated team that focuses on hypertension, diabetes, and it's really hand-holding for some of our patients that are really in need of specialty treatment, reminders of patient appointments, and that really, again, reduces a lot of that emergency room admissions. Other services, preventative, restorative, and emergency dental services. This is one of our kiddos from Ellen and Cho Elementary School next door. Integrated behavioral health. We have discount pharmacy services. That's part of our participation in the 340B program. Outreach and education. We have healthcare navigators and community health workers that are focused on enrollment in Medicare, Medicaid, SNAP, WIC. We offer transportation services. And then again, we're very proud of the fact that we were credentialed again as a patient-centered medical home. Some of our expansion or growth drivers, continued expansion of services to meet patient need. We have very, very strong word-of-mouth referrals. That's our biggest referral into our services. Community health workers to ensure continuity of care, focused care management, and strong community partnerships. Union Public Schools I touched on, and then Youth Services of Tulsa. Collaborations, we deliver our babies at Hillcrest. We do newborn rounds at St. Francis Health System, Union Public Schools. We have an embedded pediatric program with the Parent-Child Center of Tulsa called Healthy Steps that we're very proud of. The Centering Pregnancy and Parenting Program, which ensures that our newborn families and then our new parents get really the wraparound care that they need. Youth Services at Tulsa, also a proud partner of Morton Comprehensive Health Services, which is the other community health center in Tulsa. My friend and colleague Susan Savage runs that organization, and we're very proud to partner alongside with them. Emergency Infant Services, and then we're also very fortunate to receive private support to help with our uninsured numbers for the primary philanthropic partners in Tulsa. And we also have more than 10,000 annual referrals to specialty providers in Tulsa. Just touching on, again, I know this is not going to be any news to you all, but some of the community challenges that we are experiencing in Tulsa. Oklahoma ranks 8th worst in maternal and infant health, preterm births, infant mortality, adequate prenatal care, health disparities across different parts of the community and across racial ethnic groups. South Tulsa residents on average live approximately 10 to 14 years longer than those living in North Tulsa. We have high teen birth rate in Oklahoma, and we all have high rates of cardiovascular disease, cancer, hypertension, and stroke, and largely in part due to obesity, poor diet, physical activity, and tobacco use. And again, I know that's not a surprise, but just a reminder of some of the health challenges that we're dealing with in Oklahoma and how community health centers are uniquely positioned to address those things. But we have improvements to celebrate. And in very recent years, we've seen a slight decrease in infant mortality rates. We Due to the Medicaid expansion, the percentage of births covered by Medicaid has increased, and that leads to a pipeline of better health care for maternal and child health needs. The teen birth rate has also slightly decreased in recent years, and that's largely in part due to philanthropic investments in those areas for expanded education and designated teen and young adult clinics. And Community Health Connection is proud to be the largest participant in that. This is a picture of our teen and young adult clinic. They have separate entrances, they have a separate lobby, dedicated providers that really cater to teens and young adults. And last week, you all have probably heard in the news that the Tobacco Settlement Endowment Trust awarded nearly $150 million in healthcare investments just last month. And that's urban, rural, and specialty care. And out of 167 applicants that applied for those funds, only 14 were awarded across the state, only 4 in Tulsa, and Community Health Connection was one of those. And we were the only community health center. Thank you. And it really is, TSET does not do capital investments very often, so this is a huge investment in the state to help in a large amount of areas. So my last slide before a quick video, this is what TSET is going to be investing in. Our 5th health center, it's going to be on the east side next to our current Ellen Ochoa Center. The new health center on the right is so currently under construction. We broke ground on November 17th to be completed the first quarter of 27, and it's going to expand our pediatrics and OBGYN services, and again, will be a pipeline into the broader services Community Health Connection. It's going to serve an additional 3,000 families, and we are so excited about this. And once we consolidate our peds and OB services, this will allow us to expand family medicine services too. So a quick little video I'm going to show. This was our groundbreaking, and it's a really good example of our community school partnership with Union Public Schools and just what this new building is going to do for Tulsa. We're excited about.
What we know at Union is that when families have access to health care, they are in better shape overall, financially, health-wise, they learn better in school, and everybody's more successful.
This is a very, very exciting day for all of us. We are very excited today to be breaking ground on our 5th health center and our 3rd health center in partnership with Union Public Schools.
2, 3. This is a real reflection of our community schools model that we started over 2 decades ago. This is
That's Union Public Schools Superintendent, Dr. John Federline.
Dr. Hartzler, Jim McCarthy, and we're the next generation, so it's up to us to make it even bigger and even better and serve more kids and their families.
We are going to be opening a dedicated pediatrics and obstetrics unit. It's going to allow us to expand those services and serve an additional approximately 3,000 families a year. To say that Union Public Schools has been a partner of Community Health Connection is a gross understatement. They have really been instrumental in our growth, donating the land, opening up their school for in-school programming for dental services. They have just been absolutely a tremendous partner and really a model for the rest of Oklahoma of what a true community school partnership looks like.
You all have already set an example of partnering with Union Public Schools, partnering with local hospitals, partnering with community organizations, and that's how we get there.
When we opened the Ellen Ochoa Health Center in 2020, we called it a community school village, the first of its kind in Oklahoma. We were proud then, and we're even prouder now as we break ground on this expansion.
Whether it's coming into our health center, going into the schools, we know transportation's a barrier, we know language is a barrier, we know cost is a barrier, and so we try to eliminate as many of those barriers to make sure people are taking care of themselves and refer their friends and families. We try to do everything we can to make sure that people get the care that they need.
What a truly great day for our city and everyone who calls home, this neighborhood, the school community. We're building a more healthy, equitable future for the next generation of Tulsans.
There's such a huge need for healthcare and healthcare resources in our community. We're hoping that all of the families in the Union area and all the families in Tulsa really make strides to having affordable healthcare and access to healthcare resources for whatever they might need.
We share a vision in the fact that education is one aspect of a healthy life. Healthcare is another aspect of a healthy life, but you have to also address transportation, you have to address mental health, you have to address food insecurity, housing insecurity, and our missions align in that respect. So it's been a great partnership, and we look forward to just expanding more and more.
We are so excited to see this addition and be able to serve even more families.
We hope our new building will be up and running by the end of the first quarter of 2027. So thank you, Union Public Schools. You've been a wonderful gift.
Let's break ground today with hope and grateful hearts, and let's continue the work of creating communities where every child can learn, grow, and succeed. Thank you.
Thank you for letting me share that. And that's all I have, unless I welcome any questions about what we do or the community health center model. Yes, sir.
Help me with a couple of numbers that you laid out there. $19 million for a budget, and I think, does that budget cover the entire breadth of your services, say, across the state? And then also, then that number relates to the 375,000 people that you serve? Is that another way of thinking about it?
So thank you for the question and letting me clarify. So our budget just at Community Health Center for our four centers is about 19 million. Our fiscal year started December 1, so that's going into fiscal year 26. That just covers the approximately 20,000 individual patients that we serve in Tulsa. The 345,000 is the scope of patient care that community health centers in Oklahoma cover. And we're the fourth largest community health center of the 22 in Oklahoma, but the 19 million just covers the 20,000 unique patients that we serve, and projecting to serve in close to 70,000 encounters this next fiscal year. Yes.
Garrett, I was just curious if FQHCs have any services specific to the developmentally disabled in that population.
So we do have a good number of people, and we don't, for specialty care, we rely on a lot of partners that focus more on some of those developmentally disabled patients that we may encounter. But we try our best to take care of primary care. We're set up to do that in dental, but we do work with some community partners that may help us in things that we're not specially skilled at. Thank you for the question about that. Yes, sir.
What are the factors that allow you to deliver your services at 24% less on Medicaid patients than other providers?
So it's really saving the overall Medicaid system 24% is what the national and state number is. We focus heavily on that medical home model where it's getting young people and across the board in for primary care, repeated primary care, immunizations, chronic disease management, keeping people out of the emergency room, keeping their chronic health conditions under control, medication management, those kinds of things that we're really geared to treat the whole patient in that medical home model as opposed to kind of one-off doctor visits in an emergency situation that a more traditional Medicaid patient might experience. I hope that answers the question.
Is it safe to say you're more relationship-based than transaction-based? Is that the effective?
I would absolutely agree with that. We want our patients to not come to see us when they're sick. We want them to come for their primary care visit. We want them to come for their shots every year. We want them to get into their dental appointment, their behavioral health appointment, that continuity of care with their prescription use. So yeah, and that's part of kind of the savings to the overall health system if we can keep them engaged. And another goal that community health centers have is at least 3 visits per patient a year. And so again, not coming to see us just when you're sick, and then that's, and that wouldn't be just a primary care visit. That might be an appointment to the behavioral health therapist or dental or, Sure, thank you.
Chaz Craig has a question.
Chaz, yes.
Sensitive subject, can you talk about how recent immigration policy changes have impacted the work that you all do?
No, thank you for that. It's something that, sure, Chaz was asking about if there's any changes to the way we operate given the recent immigration changes in the political environment. Something we're definitely sensitive to and following very closely. We serve a largely Spanish-speaking community and very, very proud to be a trusted provider of that care. It's a growing segment of our community, a very hardworking and proud to be part of our community. So we've emphasized to our staff and our patients that federally qualified health centers or community health centers see patients regardless of any circumstance they may bring into our clinic. So we don't ask anything about what citizenship status, anything like that. We've also emphasized to our patients and our staff that there are very public and private parts of our center, and that their health care is incredibly important to maintain, and that it's a safe place to receive care. We have not seen a decrease in our patients. We have heard, some one-off, every now and then about patients that may have decided to go back to their home country, or we're a little bit nervous to seek emergency room care, but our patients are continuing to come and see us, and we're emphasizing the importance of taking care of that and their continuity of care. So we have not changed the way we're doing business or operating at all. We're operating the same way as we have. There are some questions about how community health centers and other organizations like Head Start and things may have to operate in the future, but we've been given legal guidance, and that until we've been given specific guidance to change the way we do things, or our grant language changes, that we're going to continue to operate as we always have. And really, that's protecting the public health and providing a safety net for healthcare services is the reason why our organizations were founded, and it protects the patients that we serve, and it protects the overall public health. So I hope that answers your question a little bit. We're definitely following it almost on a daily basis on how things may change. Yeah.
I understand that part of the problem with finance of rural hospitals is the reimbursement rate from Medicare and Medicaid. I noticed you said in your talk that you had enhanced reimbursement rates from them. How does that compare with reimbursement rates for the rural hospitals you have?
I'm not 100% clear on the reimbursement rates for rural hospitals. I know that so we get a slightly enhanced rate from Medicare and Medicare for the patients that we serve, and that's a specific allowance for community health centers. And so they're a little bit more in a precarious position than community health centers. In this new budget cycle on the federal level, community health centers receive level funding and level reimbursement rate for our primary care services. So we're grateful for that, but I know that rural hospitals are in a little bit more of a like I said, precarious place, but not quite as familiar with their finances. Yeah.
Two terms, collaboration and strategic alliances with the Tulsa County Health Department, OU and OSU medical schools. Is there a collaborative or strategic alliance that you work with each of them?
Sure. So our chief medical officer is on faculty at OSU, and so that's just one alliance there. We teach those students. They come into our health centers to learn, and we've actually hired a few. We have a strategic alliance with the OU Dental School. We've had externships for the past close to 12 years, and we've hired 2 of those. And so we heavily rely on the schools to introduce their students to the community health center model, and hope that we can hire them in the future. We also have the alliance with Union Public Schools. They have a medical academy where actually the high school students are coming in to observe our staff, not just the medical level, but the back office, to help keep them in Tulsa. But yeah, we have a very good relationship with the academic institutions. And the health department, yes, yeah. Dr. Bruce Dart is a very valued partner of ours. We collaborate on the community health needs assessment to look at where are the gaps in care in Tulsa, and refer to them a lot. And they refer to us. They're a little bit more on the frontline preventative side of things, and we're a little bit more on the care side. We get a lot of referrals for prenatal and postpartum care, and then chronic disease management. So yeah, they're definitely part of our safety net family.
Thank you so much, Kate.
Yeah, no, thank you so much. Thank you all for that.
Kate, I have an invitation for you. It's not a T-set level invitation, but our Rotary Club of Tulsa Foundation does grants every year for applicants, and they're not $150 million grants, but we do grants, and I'd invite you to have your team submit a grant application to our club for our upcoming round of grants. And Tiffany, you know better than I do, are we past the application deadline for this year? August 1st, okay. Well, I would invite you to participate in that. We're grateful for the work you do in the community. Many of the people you serve are people that we try to serve as well, so thank you for that. A book honoring today's program will be donated to our partners in education. I think my oldest daughter may have written this book. It's titled How to Fix Your Parents. We've got some upcoming events, the grandest of which is December 18th, which is a holiday party at a real humble abode. Understand it's at Sarah Stokely's house, a little hovel there somewhere south. Bethany, are you going to go to the Christmas party at Sarah's house? Yeah, okay, that's a good answer. You'll have a good time. Sarah is a great hostess. December 17th, the day before that, will be our Christmas program here for lunch. I've been told by Tina Miller, who I listened to very attentively, that there are going to be a couple of really good Rotary DNA vignettes. You will be engaged, enthralled, and enraptured. And I don't know, Corey, when the last time you were enraptured, but supposedly it'll happen next week at our meeting. So I hope you all will come to that and to Sarah's. This December, Tulsa Opera is hosting the Do-Re Meals food drive to support our neighbors who have been impacted by the lack of SNAP benefits. In the true spirit of Rotary service and holiday generosity, we encourage all Rotarians to bring non-perishable food items to our meeting next Wednesday. For someone who's looking for a non-polysyllabic interpretation, that means canned goods. Bring some canned goods with you to our next meeting, and the Tulsa Opera will distribute those to the appropriate food pantries. We've got a committee meeting today. Membership engagement is in room 231. Ben, are you membership engagement today? There's Ben in the back of the room. You're at Commerce Bank, aren't you, Ben? Good deal. We'd like to take a moment to thank our Rotary sponsors. The placards in the center of your table has the name of all of our sponsors who contribute and support our club and make programs like this possible. We appreciate their sponsorship and partnership to keep Rotary strong. I don't often share parting thoughts, but I have a parting thought for you today. Sunday at church, our pastor challenged us to do something. He challenged us to hum and hold our nose at the same time. I didn't understand this, but I followed the prompt. So we hummed, "We wish you a Merry Christmas." If you hum and you hold your nose, you can't hum anymore. Why do I mention this? Sometimes we get a little unhappy. But his point was this: if your heart is full of gratitude and thanks, it's almost impossible to be unhappy. And conversely, if your heart is full of ingratitude, you're almost guaranteed to be unhappy. So this holiday season, you're probably going to run into some circumstances where you're going to start to get unhappy. And I'll invite you to try to hum and hold your nose and remember to be grateful, because if you're grateful, you're going to be happy. Thank you for coming to the meeting today. I look forward to seeing you next week.